Hello, everybody. This is Dr. Duncan McCollum coming to you from KSCO Radio. I'm very happy to be here and have a lot of great information to give to you today. And first of all, I want to congratulate you on making it to 2025. Wow, what an amazing year this is going to be. I really feel like this is going to be one of the best years for individual growth, for expansion as far as your health that we've seen in a long time. Look, we've had a lot of misinformation for years and years and years about what health is. Um, we have a huge engine pushing forward, driving us into more and more medications without getting the symptom, well, maybe to get the symptoms to get covered up, but not actually getting the core of the problem. And I think there's a revelation coming. I'm really glad to be part of it. And I know that our office is going to make a huge difference for those of you that can come in and see us and or even interact with us online. We have a great bunch of things planned this year. Right now, on this, as we speak, my office is working with Jacob's Heart, a Kids with Cancer organization. Anybody that comes in and gives a $49 donation will get a compliment, well, for that donation, a TRT, tissue regenerative therapy treatment through this week. It's happening Saturday, the 11th, and we're carrying it on through the week. So we really hope that you take advantage of that because that can change your life. I was talking to one of the instructors at the Life West Chiropractic College today. She called our office and asked about the stem cell machine or the SoftWave therapy for her arm because she, as a chiropractor for many years, had hurt her arm and had three different tears in different tendons of her rotator cuff in her right arm. And that's why I bought the machine in the first place, by the way, for my own injuries to my arm. But I talked to her for a while and, understanding that there's a lot of stuff out there that is, functional, but then there's the top end of the protocols that can be done to help you. And that's what I really have strived to make sure that I can provide for our community, starting with a SoftWave therapy machine. It's a sound wave machine and it's a lithotripsy machine. Litho means bone and tripsy means breaking it apart, or litho means rock. And so they've used this for over 30 years in the United States to target and break up kidney stones. It's a sound wave that's targeted towards a specific point, and then it shoots a sound wave into that kidney at an exact point. That sound, as it oscillates, breaks the bone apart, the stone apart, so that you can get rid of it through your bladder and urinary system. So we have a machine called a SoftWave Therapy machine that they've taken the lithotripsy machine and made it this amazing sound wave machine designed to recover your joints, recover major nerve function, recover circulation, help rebuild the damaged capillaries, the smallest blood vessels in your body. So there's so much that these can do. And we have that opportunity to come in this coming week, the 11th through whatever it is to Friday. And I'd love for you to come in. I talk a lot about that in my new book, Turn Back Your Biological Clock. So you can get the book on Amazon and it will reference, what happens with when the damaged joints occur and what you can do to actually, how the sound wave works and in depth. Recruiting your own stem cells to the area, pushing out toxic inflammation, and bringing in nutrients and oxygen to help restore the area. That's pretty cool. And so if you're hearing about this now and you didn't get to come in on the 11th, call this week and come in because we've had tremendous results. You've got to go on to my website, or excuse me, my YouTube channel, Dr. Duncan McCollum, and see some of the testimonials. They're just phenomenal. This one guy came in, he was a appliance repair guy, could barely even bend over, was in chronic constant pain for years. And he came in for this treatment. You go look at his his testimonial. I can't even give it justice. He came back and said, I'm just coming in back to thank you because of what you did. And it's not what we did, it's what the SoftWave Therapy technology does, and coupled with your body's own ability to heal itself, that is allowing these amazing things to happen. You need to come and find out. Our office is buzzing with people that are so excited to be here, and we're making huge changes in their health. And last year was amazing, 2024. Lots of challenges. Doctor moved out of town, and we had to find a couple new guys to replace him. Amazing docs. We've moved into peripheral neuropathy, which I'll be talking about quite a bit today. And we're getting amazing results with peripheral neuropathy. So a lot of people don't know what that means until they actually get it or they have the symptoms and look it up online and find out that this is what they got. So periphery means anything outside of your central nervous system, anything outside of your skeletal spine, not your legs and arms, but just the spine itself. Anything in that spine is the central nervous system, which is like the inside the house. And as soon as you step outside the house, you have the peripheral nervous system. You have 31 nerves that come out of your spine that go to 75 trillion cells. And as these nerves exit the spine and go to the different organs and tissues and individual cells and muscles and ligaments and tendons and toenails, as long as the communication's working well, the body will do what it's been doing for centuries and eons for bodies, whether you're an animal or a Homo sapien, what have you, but it has this amazing ability to heal. And what stops us from healing is damage to the communication system, be it the physical nerve function itself, which is huge, or chemical destroying and eating the nerves and breaking down the protective coating around them. So they basically corrode like a battery cable on your car. And then, of course, mental, emotional, which is huge. And we've had more stress in the last 5 years than I can imagine, unless the United States was at war and we were being attacked here by known huge armies of some sort. That is going on around the world, and I couldn't imagine how terrible that would be. But I know what a silent, invisible war could do to you. A silent, invisible war like the one we had starting back in the end of 2019 and still going on today. You can't see it, feel it, taste it. You don't know if it's behind you or in front of you, but we've been brainwashed to a point where we were, those of us that fell for it, afraid to breathe, afraid to walk, afraid to touch anybody. And this has caused tremendous damage to our psyche. Now, a lot of us have gone, okay, that's it. It's not going to fool me once, shame on me, right? Are you? Fool me once, shame on you. Fool me twice, shame on me. So let's get to that point, right? That we are really starting to take a look at what is happening with our health. And thanks to RFK, this will be happening. We're going to be looking at a major shift in the way health is delivered in our country, the information that's delivered regarding health. A lot of stuff will be exposed as to what's happened to the peoples of Oath, especially our country, because we're rated 50th in the world for health, and there's 49 countries healthier than us, and we have more drugs than any of them. So if you have more drugs and they're supposed to work, shouldn't we be the healthiest country in the world? That would make sense to me. But we're not. We're 4% of the global population, and we take 50% of the drugs. You've probably heard me, if you listen to my show, talk about this quite a bit. And the funny part is that I give people these statistics and I see their eyes glaze over like, no, do you get that 4% take 50% of the drugs and we're rated 50th in the world? And it's been going on year after year after year. Something is wrong with this equation, all right? Unless you're never heard of Einstein's theory on doing the same thing over and over again and expecting a different result. So we are at the precipice of an ability to change our health in this country and in your family and in your own health. last week I had one of my staff members, Crystal, and a few others on to talk to you about what we do at the office. And one thing Crystal said is something that she'd read that said, we all are challenged. We have so many different issues and challenges in our lives, but none of them compare to anything when it has a health problem. Health, everything pales to your health when your health is an issue. So a couple points is maybe that stuff that you're worried about really isn't that important, or maybe it's time to take care of your health over that, or both, perhaps. One of my favorite coaches throughout my 35 years in practice used to tell me, Duncan, 99.99% of the stuff you worry about never happens. And he would repeat this because I'd tell him, I'd get on the phone with him and talk about my practice and the way people look at their health and, how difficult it was getting to get people to actually understand the body had the ability to heal itself. And, it was a struggle for years. And I was concerned. And he said, Duncan, 99.99% of the stuff you worry about never happens. And, it took about 8 years. I have the plaque on the wall of how many years I worked with him. I was thinking about challenges and I was concerned and I was getting myself worked up into a fizz or whatever that you get yourself worked up into. And I went, you know what? 99.99% of the stuff that I worry about never happens. And boom, it was my thought. It was my understanding. It was my decision at that point to, sure, I have concerns about stuff and I worry about stuff. But at that point, I went, you know what? I've got to really evaluate what I'm worrying about. Every week, there's something that goes on, and maybe every day that could own me. And I've learned over the years, thanks to Dr. John Baker, who was my coach at the time, that 99.99% of the stuff that you worry about never happens. So that was huge. And he also told me something else. He said, what you think about, you talk about. What you talk about, you bring about. So this is an incredibly important group of words. What you think about, you talk about. And what you talk about, you bring about. So there's a couple sides to this. Number one, if you have something on your mind a lot, usually with close friends or not so close friends, you'll bring it up and have a discussion favorably or unfavorably about it. And if you don't let it go, it owns you. That becomes a problem that owns you, And so um, if you continue to bring this thing to your mind, pretty soon it is reality for you. So we want to help you change your reality this year. So what you think about, you talk about. What you talk about, you bring about. I have bottles of vitamin G in my office, the greatest vitamin that there is on the planet, vitamin G, 100% gratitude. And you can come pick them up. They're free. And in that bottle, it's 100% organic, hand-picked, hand-harvested, hand-packed gratitude. And when you read the label and the instructions on how to use this gratitude, it could change your life if you let it. Because there's three stressors in the world that get us. And those three stressors, if you could become slightly on top of them or more at cause over them than them destroying your life, if you could start to work towards a little bit more control over those three terrible stressors in your life, they'll make you stronger. The stressors can either kill you or make you stronger. I'll give you an example. Look at a diamond. A diamond undergoes tremendous stress for centuries, tremendous stress. And out of that coal becomes a diamond, the hardest element that we know. So that was a stress. It could have been a bad stress or a good stress. Peer pressure growing up. These days, it's gotten whatever out of hand one way or another. And the manners that are not taught create a lot of issues. Not to say that there weren't bullies back then and these type of groups that would, you know, uh, alienate others or such. But there's a competition part of stress that is, you know, though you can rise towards it. Great achievements comes out of stress and diversity. You know, you have to decide you want something and work hard for it in order to get it. So that's a stress, a mental stress. Now the gratitude bottle will help you a lot with that because it's talking on how you can actually overcome um, the things you want it to be predominant in your mind. You want the predominant thought to be gratitude in your mind, not what's going on, what's happened to you, what's going to happen to you, which usually doesn't anyway, because 99.99% of the stuff you worry about never happens to you. But you want to really start to dominate your thoughts with what you want to have happen. That could be health. You know, all the problems in the world go away when you have a serious health problem. That's predominant. And then what ends up happening, unfortunately, is people might go and cover up the warning signs of that health problem by taking some kind of medication that manages the symptoms but doesn't actually handle the underlying cause of the problem. And that's just left to expand and grow into something more and more devastating to a point where it will actually own your life. And, you know, who knows where it's going to go from there. So when we look at the transition of health in our country over the last 100 years, when Rockefeller bought up all of the independent oil companies and put them out of business, and then figured out that oil could be used as a pharmaceutical. They could make different types of pharmaceuticals out of oil. So he bought up or all of the um, Western medicine colleges in the United States. He closed down through bad publicity all of the homeopathic teaching schools in the United States. There's 130 or 180 of them. I can't remember which number exactly. Prior to this, prior to the turn of the century, the 1900s. And he had a guy, reporter, I think it was the Fletcher or Fletchner report, and he went around and started discrediting anything that wasn't allopathic. So allopathic means you do something from outside the body, put it inside the body in order to make it healthy. So allopathic medicine was born out of um, this whole turning oil into synthetics, turning it into different types of medicine. So the Rockefellers. And so Fleckner, whatever his name is, you know, I'm not here's the thing about my radio show. I'm not trying to pretend something I'm not. You know, if I don't know the name of something and I know what it stands for, I'm just going to tell you. I could look it up. I think it's Fletchner or Fleckner. You can look it up. But what he did, he worked with Rockefeller and he discredited all of the other types of medical practices till the only one was the predominant one was that taught through the medical schools. And Rockefeller funded them. So they had to teach the doctors what he wanted them to teach, or he'd take his funding away. Pretty crazy, right? So the whole avenue or bent of medicine went through a guy that was looking for profit, not understanding disease. He was never trained in medicine, but he was trained. I don't even know if he was trained in finance. He just figured it out. He figured out how he was going to monopolize the world. In fact, he had all of the oil companies where they finally created something called the Sherman Antitrust Act, and they broke all those companies into Exxon, Chevron, Shell, you know, Texaco, and all those, all because of the monopoly that Rockefeller had on that. Well, that same monopoly is basically owned in the pharmaceutical industry right now. It's been pushing and pushing and pushing over medicating with these drugs that don't cure you, but they manage your symptoms and oftentimes cause and create different symptoms than the one you were treating. So I've haven't played this in quite a while, but I have an interview with Dr. Jason Fung, a nephrologist working with diabetes, and diabetes, 60% of the adult population or the population in the United States are diabetic or pre-diabetic. 60%. This means that you have a blood sugar problem. And that means that if you have too much sugar in your blood, you probably have too much insulin in your blood, either that your pancreas is trying to make or the pharmaceuticals are putting in you. We know that too much insulin in the blood causes tremendous amount of inflammatory conditions, including Alzheimer's disease. So the chronic abuse or use of insulin, whether from your own high blood sugar and your own pancreas dumping insulin in your blood, or the increased amount of insulin through the injectables or whatever form pharmaceuticals are putting insulin in your blood, you end up with a condition called hyperinsulinemia. Hyper, of course, means hyper, too much. Insulin, of course, means insulin. And emia means blood. So hyperinsulinemia simply says too much insulin in the blood or a high amount. There's a couple other synonyms for that. Hyperinsulinemia, another term for that is Alzheimer's disease. Alzheimer's is diabetes type 3, hyperinsulinemia, and Alzheimer's, all synonymous. So this is a condition that we didn't see it very much at all. We saw some dementia back in the 80s and 90s. My aunt, my grandma died of hardening of the arteries. That's what they called it back then. That was, a lot of the synthetic oils, the margarines that we took, and the corn oils and all this stuff that we were told was good to eat. And it actually hardened the inside of our arteries and our cells themselves. It made the cell wall so crispy that nothing could get in it. So it created a diabetic-like syndrome where insulin could not open the door to let the sugar in the cell. This went on since the World War II. And, when margarine came along, oleo, that became very popular. In fact, one of my best friends, a medical doctor, now, he and I were talking. He goes, and I remember because we grew up a couple doors apart from each other. He said the other day, he goes, I remember we came to your house and we always had butter. Whenever we came to my house, we had margarine. Now, his dad was a doctor. His mom was one of the most brilliant medical librarians I've ever known. Of course, I was pretty young, but she was brilliant. But they were eating margarine. Margarine, if you take a cube of margarine and a cube of butter and some plastic and you put it all out in the yard and you leave it there for a certain amount of time, only one of them is going to be eaten and destroyed by animal type people, molds to animals, to rats, to mice, to birds, to butterflies, to people. That's the butter. That is an edible food. Where margarine, nobody will touch it. It's an oil, synthetic oil, basically. It's canola oil, which is a rapeseed oil, which is, if you ever looked up how canola oil is made, I don't think you'd ever eat it again. Just look it up. Canola oil manufacturing online, and you'll see how gross it is. So they take canola oil, they whip it up, they put nickel in it to make it solid, and then they inject it with yellow dye number 5 or 7 or whatever it is, which we know is a carcinogen. So this adds to chronic disease. It adds to our bodies not having enough of real fatty acids, which is a broken down of healthy oils, to make hormones, to make neurotransmitters, to make joints work right, to make cartilage, to make ligaments, tendons, your brain function well, keep your eyes healthy. We need cholesterol for that. Cholesterol's been villainized and inappropriately, because now they have it so low that they want that our brains are drying up, our joints are drying up, and there's if you're on any kind of cholesterol medication, don't stop because you hear me say this. Yeah, I know you wouldn't do that anyway, but you've got to start to educate yourself. So we're going to be doing a workshop. All chronic disease ends in something called peripheral neuropathy. So we'll be doing a workshop on peripheral neuropathy. And by the way, we've been making incredible, incredible changes in people's life. We just had a woman in today. We did her third test. We test 7 different sensory nerves in the extremities, as well as take thermographic imaging. She went from 45 and 50% loss of her um, her sensory nerves in her lower extremities. And then that was in, I think, July. Then in August, we retested it, October, excuse me. She was at 25%. We did it today. She had 100% improvement in the sensory in her feet. 100%. Does that happen with everybody? Probably not. But, even 50% would be awesome when you don't feel like the wadded up socks or in your shoes, or you don't want to have anything on your feet at night because it feels weird, or you don't know where your feet are. You don't know if they're on the gas pedal or the brake. You have to watch where you're walking. You don't want to hit a root because you won't be able to right yourself and you'll fall down and break something. So these are peripheral neuropathy symptoms. Now, I was talking about a lot of things that can create dis-ease in our body. And we know that as long as you have a lot of problems in your life, once you get a disease or a condition that is harming your health, and the more drastic, the worse, that becomes the predominant thought in your body and your mind is how to get rid of that. I was thinking about this the other day because I was talking to a gentleman who had chronic shoulder pain, and he'd had it for as long as he could remember. And we're working with him, and not just to try to handle the shoulder pain, but we need to get the things that are causing the shoulder to hurt handled, which is a lot to do with the spine and the nervous system. So we're trying to drive in some new stem cells there and then ignite those stem cells with the laser treatment that we do here as well. But I remember when I was in pain for so many years of my life, my chronic low back pain, it was always there. Sometimes so much I couldn't walk, but always there. It was a chronic ache right in my small of my back on the right side. And sometimes it would go all the way down my leg. And I lived with this for probably 25 or 30 years. And even during being a chiropractor, it would come on now and then. But we kept working with my body, and we kept working with the mechanics of the body. And nutritionally, I've done a lot to try to enhance my body's ability to function well. And I haven't had that pain for years, except for one time. But, I'm 60, going to be 69 in February, but this is back when I was in my 20s. But from my early teens all the way up to my mid 20s, I was in chronic pain. And I've had a couple bad flare-ups, but the worst one came in 2021 November. And you may have heard this story before, but I started developing severe sciatica on my right side. I couldn't walk. I couldn't even go buy groceries. It was so bad. And I thought, here it is, man. This is it. I'm finally done in. My body will not recover this time. This is it. Haven't you ever thought that when you've hurt yourself or been sick? This is it. My life is not going to move forward. I have. And I tried everything. I even got an MRI from the doctor that has read all my MRIs that I've had patients get. And he looked at my crushed L5 vertebra, and he looked on the MRI and said, there's no room for the nerve to come out of that anymore. It's less than a millimeter big for that nerve to come out. Millimeter's tiny. He can barely, it's a 1/25th of an inch. And he said, you're probably going to need to have it reamed out. Well, how many patients of mine have come in with their backs reamed out? And I'm sure it helps a lot of people, but I see the ones that it doesn't help. And once you get the scar tissue, it's harder to handle it. But one way or another, I wouldn't want to have that. And I decided I'm going to keep looking. So I went to see a friend of mine, a different type of chiropractor than I'd ever been exposed to. He had, he worked on me a couple times, and then I think the third time I was walking out of his office, there was a step down. I stepped down with my right foot, and my gut exploded. It blew up like I got shot with a shotgun. My appendix blew up and ruptured on the spot. The worst pain I'd ever felt in my life. And Next thing I know, I'm getting myself wheeled into the local hospital, who confirmed my already understanding that I'd ruptured my appendix, and I needed surgery. And it was amazing treatment from the local hospitals. Um, Great staff, saved my life. But the interesting thing was the minute my appendix ruptured, I felt the pain so bad of the appendix, but I didn't realize that my sciatica had gone away. So the added hidden infection of that blown up, highly swollen appendix pushing on that nerve in my low back from the inside was enough to cause all this sciatica. So I taught myself a story. I'd even written about this in my book called Turn Back Your Biological Clock, about how I broke my back when I was 14 or 12, and how the journey I went through during the time that nobody diagnosed it correctly, and the pain and the drugs and medications and misery that I'd been in all those years. But here I am again in my 60s thinking a lot my life is over. I can't go backpacking. I can't go fly fishing. I can't walk and get my own groceries. I have a hard time getting myself to the bathroom. This was terrible. But the cool part about when this inflammation went out of my body got well. And I haven't had a problem with my sciatica since. Of course, I'm under regular chiropractic adjustments. I have a bad injury that if I don't maintain it, it will slip out of place and put more and more pressure on the nerve. I've known this after 50 years of adjusting it or not. And when I ignore it, I end up crawling in somewhere going, help me. So at any rate, this is the issue of having a problem so severe that nothing else in your life mattered. All I wanted to do was get out of pain, and I hoped that I would, because I didn't know that I could get out of pain this time. I thought this was it. The hole was too small. The nerve was going to be crushed forever. There was no way to fix it this time. Thank God my body had the ability to heal itself. I just had to remove the distractions, the communications or lack of communication on the nerves and the body's ability to heal itself. So I'd had chiropractic, no problem with that. But what I didn't know was the hidden infection in my appendix that was swelling up the tissue surrounding that nerve, causing the pain. So this is some of the stuff that I guess I need to go through in order for me to understand how to help my patients better. And it seems like every few years I had a tremendous shoulder problem. I couldn't even lift it off the side of my arm back in 2019. And I found the SoftWave Therapy machine because of that. So and now I have lasers because of something going on with one of my organs. And I bring it all here. And I go, it's here to help you. It's some of the most amazing cutting edge stuff on the planet. This sound wave or the stem cell machine works off pure sound. It comes out of the head of the machine, the lithotripsy machine, 3,358 miles an hour and goes right through healthy tissue, but it gets stuck in scar tissue or damaged tissue and signals the brain, there's a problem here, go fix it. So that's the sound part of our treatment. The other is light. We have lasers, a full spectrum of visible light. And these are violet, red, and green that actually ignite the power inside the mitochondria. By now, most people know kind of what a mitochondria is. It's like the carburetor inside your cell. And it is, I mean, in your car. So you give gas to the carburetor. You have bad gas, you have bad running of the car. You give it supercharged gas, it will run better. So the mitochondria, when we use the lasers on the area of problem, it will ignite the mitochondria and supercharge it. So the cells have a lot more ability to heal because their energy is in the cells to heal. A tired, exhausted cell won't heal. An energized cell can heal. So just like you, if you're tired, you probably don't function very well. If you're full of energy, you function better. So we're trying to turn on the energy in your cells, your body at a cellular level, as well as cleanse it at a systemic level. So what I mean by that is we need to make sure that you don't have chemical toxicity. Like that's heavy metals, molds, hidden infections, glyphosate, which is Roundup, forever chemicals, all of the different industrial things that we've come across in this lifetime and our mother's lifetime, because drugs are heavy metals and molds come down 4 generations through mom's umbilical blood. And we come into this life with a toxic load already. The work group, the environmental work group came up with 278 chemicals they found in the umbilical blood of babies that hadn't even lived outside the womb yet in the United States. So we come into this life, and on page, I think it's 149, 249 of my book, Turn Back Your Biological Clock, New Hope for Peripheral Neuropathy, I show you what it looks like to have your body, your toxic load, maybe I show a cup. The toxins are halfway full. You might make it through life really well. But when it fills up with environmental toxins, plus the one you came into this environment with, and the ones your body makes on it every time it produces energy, pretty soon that will fill over. And it's like your cup runneth over with toxins. Chronic disease occurs. Bad genes get turned on in the cellular level. You end up getting autoimmune diseases. Your body's fighting itself. And all of this, the treatment of it, the drugs and medications, as well as the symptoms of the condition itself, can cause something called peripheral neuropathy. And that's what we can help. So I'm doing a workshop this coming Wednesday and Thursday. The 15th is a lunch workshop. I think it's 12 o'clock or 12:15 or something like that. And then I'm doing a dinner workshop on the 16th, which is Thursday. That's 6 o'clock, I know. But you can call the office, 831-459-9990, and find out when that workshop is. Let us know if you want a seat. We'll save you one. We've got several people already signed up for it, but we have room for more. It will fill up. It always does. And it's a free workshop that I'm going to go in detail over what's causing the causes of peripheral neuropathy, how it's diagnosed, what traditional care is for it, what the results are of that, which if you already have it, you probably know the results, which are medications that are mitigating the symptoms but not fixing the cause. And very possible you've been told you have to live with it. But I can tell you that this is not true in 99.9% of the cases we've treated. We had trouble with one person. His results were better, but he was not patient enough to let us get the results I think we could have gotten with him. Now, considering that this is considered a non-reversible condition by many in the health field, and that we do turn it around pretty remarkably, I think it's definitely worth your time to check it out. The workshop's free. It's Wednesday, I think 12 or 12:30 or 1, something like that. But you can call and find out. So you either can come Wednesday lunchtime and we'll give you a sandwich or something to eat, or Thursday evening at 6 o'clock, and we'll do the same. We'll give you something to eat, keep you nourished so you can think, and we'll go over the elements that can cause peripheral neuropathy and then what you can do to fix it. So I'm very at the beginning of the year, and when we looked back at what we did last year, we helped more people last year than we've helped previous years. And we seem to keep growing more and more and more because we're just getting such good results. And if we don't think we can, we'll let you know. There's some that you go, well, we're just going to have to try and see because there's so much. Usually it's because there's already so much medical intervention that has been tried, like surgeries, hardware, put in the spine, the hips, the knees, ankles, arms, shoulders, but we still do get remarkable results in most cases. So it's worth 49 bucks. Oh, you don't have to. I'm talking about the TRT. That's that. But for peripheral neuropathy, no charge to come. If it makes sense to you, we can talk to you about doing the examination that we do. We do 7 different nerve channels that we test on your hands and feet. We test for cold, something called the pinwheel, which you may have had before, where they run a sharp pinwheel up and down your arm, and we see if it's numb or not, or if it's hypersensitive. Then we do a monofilament light touch, like a hair going over. Are those nerves working? These are all different nerve endings. It's not one nerve serves all. These are all different hair-like nerve endings that are actually conducting communication from the feet, hands, or to the brain and back. Then we do vibration, deep tendon vibration. And these nerves that when we put a vibration on your a tuning fork on your bones of your hands or feet, you should feel that vibrating all the way up to the brain and back. If you don't feel it, that means there's quite a bit of deadening of the nerves and those large the large nerves going down your legs or hands. So then we do that. We do cool. So there's a difference between cold and cool sensation. I probably forgot individual touch. We look for fine point discrimination with that, where we poke different parts with a sharp object to see if you can recognize it. Oftentimes there's no feeling. And then heat, we put a blowtorch on you, and it's basically a hair dryer. And sometimes people are shocked that they cannot feel the blow dryer on their feet. This is telling us that the nerves are retracting out of that area. There's been damage, whether it's physical or chemical or both. So it's kind of like I use this example of taking a plant out of the ground and you have all the roots and you wash the roots off so they're just the white roots. You take that and you dip it in some type of toxic element, those roots are going to start to die. The life is going to go out of them. And the stronger it is, the quicker it dies. But if it's very subtle, it's a slow death of uh, those roots, or in your body, those nerves going down to your toes and stuff. And you take that out quick enough and put it in a healthy, nutritious fluid, and the likelihood is that it's going to come back. Just like the house plant you didn't water for a month and then remembered. You start watering and it's very forgiving, and it decides to come back and beautify your house with its presence. So we do all those tests, and that gives us a number of what degree you've lost conduction of the nerves in your hands and feet. Now, if you have peripheral neuropathy in your feet or hands, very often at the same time, people are starting to notice dementia, the lack of acuity, and this is the problem here is telling us that we all have heavy metals, molds and hidden infections, glyphosate, which is Roundup, the accumulation of forever chemicals in our body and in our brain and the fat tissue through the compromised blood-brain barrier, because glyphosate itself opens it up and our food's getting sprayed with it liberally. But once we have a understanding of what your peripheral neuropathy is, we can start to turn it around for you. But when we look at the numbers on your hands and feet, oftentimes I say, look, there's mercury. We do an oglio scan, which is a photocytometry, which is cyto means cell, photo means take a picture of it, and ometry means meter. So we get a photograph measuring the elements in the cell. We can look at heavy metals, we can look at vitamins, and we can look at minerals inside the cells individually with this thing. We just need to know your blood type. It's really remarkable. Probably the most accurate for heavy metals there is. In the old days, people would do hair analysis, which is 3 months later, it's coming out of your head, and it may be compromised by shampoos and environments. And it's still telling us what's excreted out of the body, not what's hidden in the fat tissue inside the brain or in the cells. It's only what's being excreted, not what's hidden away. Blood measurement is totally inaccurate, because if the full concentration of heavy metals was in your blood, it would kill you. So your body hides it in fat cells and fat tissue, including the brain, to keep it out of the bloodstream, because it's not water soluble that way and it can't hurt you. The other one is urine, where you take a urine sample, and we usually have you take a provoking agent, which is a chelator that will help pull this stuff out of your cells so we can get a sense of what the level is hidden. And that was probably the best up until the oglio scan came up. Now that is the best. It helps us look at a cellular level, what elements are in there, what vitamins you do or don't have, and the amount of heavy metals and what percentage above normal or below normal of any of those that you should have. Your nerves aren't going to grow if you don't have the proper elements, if you don't have the proper amino acids, fatty acids, and vitamins and minerals, especially if you have enough, but you're toxic with heavy metals and stuff, they're not going to grow back. So we need to help you get those to grow back. And once we have a number, we'll put together a program for you. It usually includes number one, chiropractic, because the nerves come out of the brain, go down the spine. 31 nerves exit the spine, and those 31 nerves divide until they go to 75 trillion cells. So is that important? Absolutely. You have to take a look at nerve conduction. And then we need to take a look. So we work with the nervous system down. So we're regenerating the spine, the nerves from the top down. And then the second thing is what's going on at the tips of your toes and fingers. So with all of the stuff we do in the office and we give you home equipment, we're working from the feet, the bottom up, and those things will meet in the middle, restoring nerve function is, usually relatively quickly. The gal I talked about earlier today, she's in her 70s, and she came in with 50% loss and destruction of the nerve conduction in her feet. Really bad. Within almost 6 months, all of her tests came back at a 10 out of 10, maybe a 9 here and there, but predominantly a 10 out of 10. They were threes, fours, fives on all those tests I mentioned before. And it's just amazing because we know that the nerves will grow a millimeter a day if you do the right things. It's all over the internet, it's all over PubMed. Peripheral nerves will regenerate if you do enough of the stuff quicker than the bad stuff can destroy them. And we've become very, very good at this. And we have the equipment here that very few people have. I don't think anybody in town has what we have. Um, and the conglomerate of all of it put together, the whole is greater than the sum of parts. It's like cooking a good recipe or like a cake, grandma's cake. My grandma was born in 1892, so everything was by pinch here, and she never told anybody the real recipe. But if you leave out an ingredient, it's not going to be grandma's cake. So if we don't do the peripheral neuropathy treatment the way we know how it works, you're not going to get the results you want. And this is nothing to mess around with. If you're going to go after it the right way, as fast as you can. And usually within 6 months, you have a tremendous results. And but that doesn't mean you're done. This is like a weakness in your body, and you're going to need to learn yourself how to maintain this for the rest of your life if you want to walk and enjoy the grandkids and golf and take hikes on trails. It's like building a muscle. You got to keep building that muscle. You got to keep walking. You got to keep doing the things that got you the health that you wanted so much. So we're excited about it. I hope you decide to come to our workshop this week, Wednesday and Thursday. Wednesday's a lunch meeting, Thursday's a dinner meeting. We do have seats left at both still. They're probably going to go fast. And in that, we going to go over everything that we know and do. A lot of it's going to ring true to you. If you decide you want to pursue it, we will do an exam on you. We basically doing a full neuropathy exam. We do a set of spinal x-rays. We do all 7 um, neurological tests for sensory. We do a thermographic image of the extremities to see if there is oxygen, if they are oxygenated, or if they're starting to decline or the nerves are starting to die at the tips and grow backwards. Um, we and then there's a fee of $99 for that. But believe me, you can waste that money anywhere. It's about a $700 thing because it will include a stem cell treatment. So in that, you do get the treatment as well, which is pretty cool. And or if we decide to do the laser, we could do that instead, depending on if there's any factors that would say do this, not that, and that we can determine at the time. But I'm very excited for this year, 2025. We have a great staff. We really, really strive to treat people the way they want to be treated, the way we would like to be treated. Everybody is important. Our staff are amazing, friendly as heck, and they care. They really do care about you, and they want to help you. So when you come in or when you call the office, you'll talk to one of the staff, whether it's Magdalena, Belle, Crystal, or Natalie. They're all amazing. They'll set you up to come to the workshop or just for an appointment if you want to come in and say, hey, just do the tests on me. I want to do them. And or if you have another problem, if you've got, neck pain, shoulder pain, and you just want to try the stem cell machine and have us evaluate it for you, that's $49 for that. But at that point, we'll do all that evaluation of you and decide what is the right course if we can help you. Also, what is it that you want? Not everybody's going to come in and say, "Get me working at 100% right now." Some people don't have time. They just want to get out of pain and get on with their life. And then other people are going to come in not knowing what the heck we do, have never been to a chiropractor. They don't trust us. I didn't trust chiropractors before I was carried in because I couldn't run away. I was carried in by two friends. I'd been on flat on my back for 3 weeks and I couldn't even get up to go to the bathroom. I couldn't eat. No street drugs could help me. No medical drugs help me. No alcohol could help me. No, back then it wasn't medical. No CBD or THC products could help me. I was miserable. And looking at how I found myself to the Golden Gate Bridge, to be quite honest with you. It was so bad, and I'd lived with it for so long that I was giving up hope. And thank God, a couple people took me. These I don't even know who they were. They took me to a chiropractor. Dr. York made them hold me up so I could get an X-ray of my back. Then he disappeared into Dr. Jekyll's closet, and he came out and he put a X-ray on the view box and he pointed to the very bottom bone of my back and said, "When did you break your back?" It was, it devastated me. Nobody'd ever been that thorough. Nobody'd ever taken an X-ray in all those years since I was a kid and fell out of a tree. And I was at that point pretty addicted to painkillers. And I was 20. And he said, "I think I can help you, but if this adjustment doesn't work, you guys are taking you to the medical doctor." Because at that point, my organs weren't working. My large intestine was not functioning, and it became a life-threatening condition. But the miracle that he pulled out of his pocket when he had gave me my first chiropractic adjustment is why I'm here today talking to you, because it saved my life. It changed my life. And I want you to have that. I want you to experience, you got to trust in something, you know? And if you come in here and you decide you don't, then we're not the office for you. But if you're sick and tired of being in pain and you've tried everything there is and you want hope, and you haven't tried everything because you don't have what we got. I can tell you that right now. But I haven't even talked about some of the stuff, other things that we can do to help you here. And if there's a will, there's a way. If somebody's going to help you, we probably are going to be that person if it's a natural way to help you. There's a lot of great chiropractors out there, acupuncturists, naturopaths. If you want to go to them, go to them. But if you are listening to this message and going, I got to get this fixed, this is the guy I want to come see. Come meet us. I never charge to sit down and talk to anybody about their condition ever. If we need to do an X-ray or some kind of something else, I will tell you what that is, and we will go ahead and figure that out for you. But anyway, it's nice talking to you there. I've got 40 seconds left. So Dr. Duncan McCollum, 831-459-9990, 831-459-9990, 831-459-9990. All right, y'all have a great day, a great evening, and we'll see you Wednesday or Thursday. And until then, we'll talk to you soon.